If symptoms persist, what can be done?
Then it's time for surgery. And there are several options that exist. But basically, the goal of surgery is to make the canal wider so that you decrease the pressure inside the canal and the median nerve can stop worsening and can improve and heal. There's basically two ways to do this. One is the old-fashioned open approach, where you have to open up the hand, you cut the skin, you cut the subcutaneous tissue, you cut the muscle, you cut everything that's in your way in order to get to the ligament that's causing the restriction on the nerve. But there's another way that's more recent, where you don't have to violate the hand at all, and all you do is a small keyhole incision in the forearm, and then you get inside the canal with a camera, and with that camera, you see the ligament that you need to target, and you basically cut that ligament open, and therefore you're widening the canal and decreasing the pressure inside of the canal over the median nerve. And you get out of there, and there's no sutures in the hand. Recovery is much quicker. There's less scarring, less pain, and less downtime. Those are the two ways to treat carpal tunnel syndrome nowadays. One is more recent. The endoscopic approach allows you to treat both hands at the same time under local anesthesia. Recovery is really quick. People can go back to their activities within days. They can go back to sports within maybe a few weeks as opposed to a few months with the other technique. Again, going back to work is much faster with the endoscopic approach than it is with the open procedure.
So it's very effective.
Very effective and very safe as well.
Any potential complication?
Yes, just like in any surgery, you could have an infection, you can have a damage to a nerve, to tendon, to a vessel, you can have stiffness, you can have wound healing problems, but those complications are really rare, and even more rare with the minimally invasive approach, because you violate less tissues, so there's less healing required, less adhesions, less of that. A little more common with the open procedure. But again, both procedures are safe, but I think one of them is just less invasive and causes less problems. Another great benefit is that when you treat both hands at the same time, you have only one downtime period versus two stages, because you need one hand to do some of the things of life, so you can't do open procedures for both hands at the same time. It's not. Some people do it, but it's really not recommended.